Good afternoon, everyone. Thank you for joining us here at LittleAfrica BronxNews. My name is Mona Davids. I am the founder and publisher of LittleAfrica BronxNews. As many of you know, we've launched a series, a video interview series called Meet the Candidate, so that our viewers and Bronxites could learn more about the candidates and their platforms. All candidates running in Bronx City Council races, the Bronx Borough President race, the Comptroller, Mayor, and Public Advocate. So I am very happy to introduce our candidate for today's interview, Dr. Fernando Cabrera, who is currently the City Councilman for District 14. Dr. Cabrera, thank you so very much for joining us today on LittleAfrica BronxNews. Happy New Year, sir, to you and your family.
Thank you so much. Thank you for the opportunity to be here with you and to be able to share about myself and about my platform and my vision for the Bronx.
Wonderful. Well, again, thank you for joining us today. So, Dr. Cabrera, you are known to many Bronxites, but for some of our viewers who are not so familiar with you, please tell us about yourself.
Well, I was born right here in the boogie down Bronx. And when I was 4 years old, my father took us to Puerto Rico because he was an airline mechanic. At the age of 14, however, we went to California. My brother was a chronic asthmatic. I was asthmatic, but he had a level of asthma that basically the doctor told him because of the environmental factors there, if he stayed there, he was going to die. He was right about that. So we went to California, and at the age of 22, I went to Virginia to work in a rehab program, but I always felt a call to come back to New York. When I was just 25 years old, me and my wife, we started a church. I felt a call to start a church, to work in the Bronx, and that was 1988. Where people were running out of the Bronx. I was coming in, and soon thereafter started working. I always been bivocational, so I started working as a caseworker in South Brooklyn Prevention Program, though I was living in the Bronx. And then I became a school counselor, earned my master's degree, my doctorate degree, and ended up becoming college professor. I ran the graduate program at Mercy College. Started the first mental health counseling program, master's program in the state of New York, and the first online program, especially for single moms that, sometimes with the child care. I came from a broken home. I know what my mom had to go through with 4 boys, and this enabled this program to allow for those moms to help out, but to be helped out. But then I started to see my district where I live and where my church was located and still located, that kids were getting shot. I remember one kid just got shot. Two young people who were just hanging out. One became blind as a result of that, and the other one, bullet went right through him. I remember speaking to him, and I didn't see the presence of elected officials, nobody speaking up. And so I realized that even though I had a platform as a professor, I had the platform as a pastor, I needed a political platform to exert change. And what was really interesting at that time, we had the worst unemployment in the city of New York. Can you imagine? 23.5. This is according to the Furman Center. Crime was out of control. Kids were not graduating from school. Now, 11 years later, we see that crime went down 66%. We saw unemployment go from 23.5 to 5.7. I had couple of high schools, and one of them has a 99% graduation rate, mostly ESL students, immigrants who come from other nations, and they graduate with certificates of technology. And so I had an opportunity during this 11 years to see the transformation take place. I'm also the majority whip leader of the New York City Council, and I chair governmental operations, which has the oversight of most city agencies than any other council committee. We're talking about 12 agencies that I have oversight over. And prior to that, I was the chair of the Technology Committee, Substance Abuse Committee, Juvenile Justice Committee, and also the co-chair, the former co-chair of the Black, Latino, and Asian Caucus, and still the chair of the Gun Violence Task Force. As you can see, a lot of experience, a lot of work that I have put into our beloved Bronx. I love the Bronx. I live right here in Fordham Hill. I love the neighborhood, and I'm looking forward to do more.
You have quite a long track record and history when it comes to community service and public service. So, Dr. Cabrera, I mean, right now, as you said, you came to the Bronx in the late 80s when people were trying to get out of the Bronx. And now you're still here in this time of the COVID-19 pandemic. And we cannot skirt around where we are today with regards to the pandemic, with regards to its impact on the Bronx, and now with the vaccines that are available but are still hard to get for our communities. I think it's important that we cut to the chase and we start off with, as borough president, what is your post-COVID-19 recovery plan for the Bronx? And what would be your plan or strategy to ensure that the vaccines get to Bronxites as soon as possible? Because I'm sure you've been watching the coverage about how New York City has hundreds of thousands of vaccines, but not even a third of those, of those vaccines have been distributed.
Thank you for bringing this issue, because this is actually very personal to me in a couple of rounds. The first round was that my church, including my son, my daughter, their children, their spouses, they all came down with COVID. They were one of the first close clusters at the beginning. So I experienced the impact, the negative impact very early on. And then my mom passed away as a result of COVID in August. It was devastating to us. And 6 weeks later, my mother-in-law passed away. So it's been a very difficult time for us. But what it did in my heart made me even more compassionate and understanding what many of our families are going through. So we had to deal with this COVID situation. And you mentioned the vaccine. The vaccine is critical for our recovery. The fact is that we need, number one, better education. There are many people who think that if they take the COVID-19, that somehow there could be a mutation later on and so forth. And what I'll tell our fellow people, I understand the fears. I understand what has been done to our communities in the past, especially in the Tuskegee experience in Puerto Rico, what we went through 60 years ago. But we're 60 years later, and Pfizer and Moderna don't want to get sued. That's one thing. Second of all, our healthcare providers, they're receiving. I have family members who are healthcare providers, and they're already received the COVID-19 vaccine. They have been able to recuperate. So we need to have better education. We need role models coming forth and taking the vaccine and say, look, I'm good. I'm able to survive. And those who have allergic reactions, like the who are allergic to iodine or the such, to be able to get educated as well and to see what other options they have. We need to streamline, fast track, and have as many 24 hours a day centers so people could go and get their vaccine. I think it's atrocious. I'm baffled to the fact that still we are not in nitro level speed to get this vaccine to our people, and it's sitting still in refrigerators and freezers all across New York City. And at the speed that we're going, I don't see how we're going to meet the million people mark by the end of this month. And so we need more sites. Locally here, I'm working with Morris High Health Center to be able to get our community educated and informed that soon, in what stages that we are in right now, they're going to be able to get the vaccine. In terms of recovery, we're going to have to put an injection of funding to our local business people. And I mean literally local, because a lot of funding always end up in the hands of people who are not from the Bronx, or it doesn't get here at all. Small business services only get 1% of all the loans during this COVID-19 to businesses in the Bronx.
Yeah.
This is justice. There's something fundamentally wrong with that math. With the people who have been impacted the most, our people. And so, and we've seen so many businesses close. So we're gonna, as the next borough president, if I'm chosen by the people, I will make sure that we use the arm of the Bronx overall economic development to get our people, especially people of color, to be able to get funded for their businesses, and to have a stimulus of economic development happening here in the Bronx, and attract those other companies that could provide jobs. People need jobs more than ever. And so we also got to deal with public safety issue. We've seen crime rise. And I know a lot about that because I know what I started with in this district. And the people want to feel safe. Look, people don't feel safe, they're going to leave. They're going to take their children, they're going to move someplace else, just like we saw 125,000 people leave Manhattan because they didn't feel safe. And people, including from people from the Bronx and other boroughs. So we want to make sure that we have a responsible way to deal with policing, and at the same time, be able to provide that public safety net that people need. Businessmen and businesswomen from our neighborhood, they're concerned. People, the grandmas, they tell me, please, we need more help. I put more police safety cameras than any other council member in the entire city of New York. By the way, those are not the ones that give you tickets. Those are the ones for the state. So those are not it. So and their work is one of my biggest requests I get in the district, close to $5 million. And this year I'm going to put some more cameras. It keeps everybody honest. It keeps the police honest, and it keeps our people honest. So it's a good safety net. And I started the Cure Violence program. Myself and back then Councilmember Germani Whelan, who's the public advocate right now, we started a Cure Violence program, who's working with crew members. Today, I just came out of the BRAG program, and I was spending time with them. And what they do, they have credible messenger, former gang members, that they go back in and they work with the young people, provide educational path, jobs, legal services, help them with their records and criminal records that they may have, and get them an opportunity. We started with $5.7 million. We're now to $27 million through this Cure Violence program, through the entire city of New York, the most effective one in the nation. Those are the practical, tangible ways that we can make a difference right here in the Bronx.
Oh, wow. That's great. That program had grown from leaps and bounds. No, it's so nice and heartening to hear your strategy post COVID-19. And you mentioned, the minuscule percentage of small businesses that got support from the city. And it's true. And the New York Times did a report on that. They interviewed a few Bronx businesses in the article. And Dr. Cabrera, one of the things that the common problem with those Bronx businesses that they raised was that there was no support, no one to help them complete the mountain of bureaucratic paperwork in order for them to get those loans and that assistance. And you also mentioned the Bronx Overall Economic Development Corporation. Where are they in all of this when it comes to supporting and helping these businesses? Because we also had so many Bronx businesses that are either like clothing stores or sneaker stores that were closed. They're mom and pop businesses. They're not online. They don't have websites. They couldn't easily switch to e-commerce. But whether it's them or other Bronx-based businesses, the support, the help, the assistance, the guidance in order for them to complete the paperwork was not there. So as a borough president, what would you do? We all know as a council member and all the other elected officials, they always have community liaisons in the offices. Where are the small business liaisons?
That is so good. Thank you for bringing that up. You are so right on point. And you know what? The BP's office should be the hub with the Bronx Overall Economic Development, and the office should become a hub where business people know automatically when we go through a season like this, where to go. I found myself, I'll be honest with you, I found myself doing workshops on Zoom on how to apply for the SBA loan and SBS loan. I was shocked. I was baffled how even SBS was running behind and didn't have the information. And it didn't take a lot, to be honest with you, to get that information and look at the experts were saying nationwide. And we were able to get, especially a lot of these restaurant owners that have been shut down very unfairly, because you go just 2 miles away from here, you go to Westchester County, where they have higher COVID cases than we do here in the Bronx, and yet they're open at 50%, and they had us open only at 25, and now they're completely closed. You can see I get really riled up about this because of the inequities that take place. So at the BP's office, we will use it as a hub. We will have liaisons. We will have people who were intentional. We have to have an intentional plan to do the reach out, to be able to disseminate the information quickly, provide training, provide even video workshops that they could have, and also have questions and answer, and be able to have accessibility to these resources, because other communities, they get them quicker. Other boroughs, they got ahead of the line because that was provided at that level that you're talking about right now.
Yes, yes. And because of that, our communities are suffering, because it's, we all say, small businesses drive the economy. They're the economic engine for the economy. Well, small businesses drive the Bronx economy. They're the economic engine for the Bronx, and they're also the ones that employ people from their community. So it's this domino effect that it's just has been devastating. So,
interject really quickly. I think that we need to use the platform. We call it the bully pulpit. I was the only Bronx elected official to go in 42nd Street with all the restaurant owners, and vast majority of them, 99% of them, were workers that come from our community that look like you and I, who right now, to this point, they're unemployed. And we did a march. We went all the way down to the governor's place, from 42nd Street all the way to his place, and to talk about these inequities that are taking place, and that there is no safety net. You shut down and there is no safety net and no plan to how to help these businesses open. I talked to one of them who told me, I'm in $500,000 debt. So Fernando, I have never been in debt in my life. She has 11 restaurants, and she says, I got hundreds of people who are now unemployed. And she's telling me this in tears. And she says, I'm right now, I'm in $500,000 debt. I don't even know if I'm going to be able to open back up. They shouldn't be in that situation. They didn't cause the problem. It wasn't because of bad decisions that they made regarding the businesses. It's because the government was not prepared at the highest level here, where that level of coordination takes place. And as the next borough president, I tell you, I guarantee you, we will have that in place.
No, that's good to hear, and that's encouraging, because the safety net, the infrastructure just was not there to support our small businesses, and because of that, we suffered. We really did. So, Dr. Cabrera, continuing, with post-COVID-19, when it comes to housing, and affordable housing and difficulties that families are facing paying the rent, we understand that there is now a moratorium on paying the rent. But even with the moratorium there, at some point the moratorium is going to end. So my question is two-part. As borough president, what is your plan or your strategy to help Bronx families pay or waive the arrears? Because in 3 months or 6 months, families will still have to pay that back money, those arrears, and may still end up getting evicted. So that's question one. Question two is, in the Bronx, we have a lot of small homeowner landlords who have mortgages to pay. And they're in the same position as we all are, trying to make the rent, as most Bronx families are. So what about the support for them? Because if one family has a 2-family or 3-family house, and they rent 1 or 2 floors to a tenant, they still have to make the mortgage. And if they cannot make the mortgage, they're gonna lose the house. So what is your strategy to help not just renters, but small homeowners?
Thank you so much, because that's an issue that is already it's already a chronic situation that we're facing, and it's about to get worse. I'm going to be honest with you. I'm not waiting to become VP to start working on it. I've already been working on it. The state has a program that is like the one-shot deal that we have in the city that a lot of people do not know about. And they just expanded the criteria. So what I did was I got a News 12 and we blasted out. And so we got so many feedback and response, from people saying, I didn't even know this program existed. We also got the one-shot deal in the city. So we could, between those sources of being able of funding that is going to be able to help these families that are hurting. There's nothing more scary than thinking you're going to lose your apartment. And it's not as easy to say, oh, they could find another apartment. Really? Where? Especially right here. I'm talking about the context in which we're living in the Bronx. Well, we didn't have a lot of people leave the Bronx. And so it's not like we have a lot of apartments available here. And also the whole credit piece that goes with it. So now May is coming. And so we got to connect. We got to do a better job of connecting those sources of income. In terms of affordable housing, well, I've been working on this for many, many years. My district, Councilman District 14, Kingsbridge, part of Kingsbridge, Fordham, Mount Hope, and University, is one of the only 7 councilmatic district that has not experienced any form of gentrification. That happens because we intentionally worked on getting affordable housing. Myself and my colleague, Council Member Vanessa Gibson, we partnered together. We worked so well together, and I want to thank her for that partnership. We worked together in Jerome Avenue to Jerome rezoning. And I have to tell you, in my part of the district, we already got 3 projects, huge projects of affordable housing going up, not one market rate type of establishment with retail that's going to bring us more supermarkets, banks, and etc. This is the kind of vision that I have for the Bronx, to be able to bring this level of affordable housing. And I put my money where my mouth is. We put capital funding in a lot of these projects, because to do this HPD affordable housing unit projects, they often need another infusion of capital monies. And I was able to provide that. I'm going to do the same thing this year through our capital Reso 8 opportunities that we're going to have.
Okay, no, that is great. And continuing on with housing, let's touch on the city's worst landlord, which we all know happens to be NYCHA. Every year, every winter, it's the same story. Apartments don't have heat. Apartments don't have hot water. The rest of the year, people are living with mold, living in dilapidated apartments, ceilings falling down, bathrooms not working. It continues and it continues and it continues. So, I have to ask elected officials, because for some, it seems like there's a disconnect. It's like, yeah, okay, people in NYCHA are suffering, but they're not doing much to help them. And if you ask them, well, when last have you been to a NYCHA complex? When last have you met with tenants who are dealing with this? It's like, yeah, it's happening. There's nothing we can do about it. So, it's the federal government. But I think that's passing the buck. So my question to you, and I know I'm putting you on the spot, but as borough president, or even now as a city councilman, what are you doing to help NYCHA residents?
Thank you for that question, because often in interviews, that question doesn't come up. Look, you asked me when was the last time that I was in a NYCHA building? 2 days ago. And it actually the Webster houses. Why? Because Eleanor Dow's, the elevator wasn't working. She put 15 complaints and it wouldn't stop on her floor. And so she had to take the stairs. She had to go to dialysis, accessorized waiting down below. But when she goes down the stairs, there was urine in the floor, and a tragic thing happened. She falls down the stairs. She's in critical condition right now at Bronx, Lebanon, and she's literally between life and death. So please, everyone, keep her in prayer. And I was in a press conference literally 2 days ago that I co-led. And I have to tell you, it was grueling. It was heart-wrenching to see how much the families suffer. But we took also the opportunity to talk about how NYCHA is $40 billion in the hole. And you asked me, what have you done? Look, for independence, we had a meeting, and I brought NYCHA to come as part of that meeting. And what I did was, people were saying they were not getting, they don't have stoves. The old stoves are really, really old, and the refrigerators are totally outdated and at times even not working. And NYCHA said, we don't have any money. I said, I'll put in the money. I put my money where my beliefs are at. And we were able to get funding for every single one of the resident for independence. That's not a small complex, to have refrigerators and to have also the stove. And to give another example in that place, the park have been in disarray, a children's little park playground, and we were able to fix that. It's already fixed. I put safety cameras. All my NYCHA building has safety cameras. You go to the 3 buildings I have in Marble Hill, 4 Independent, and Bailey. They all have safety cameras, and some of them even have it in every floor. So we've been able. I've been able to again give that backing that they need, and done many events there, whether it's to bring book bags to the kids and turkey giveaways that we just did this year. But as the next borough president, I'm going to tell you this. I know that many of those projects are now what they call sexy projects, right? They're not one that you're going to get a lot of press. But that's not why I'm going to become borough president. I'm going to become borough president to meet the real needs. And you have my commitment. Now I want everybody to hold me accountable once I become borough president, that will put funding from the borough president's office to this NYCHA complex, and also call upon the mayor of the city of New York to put the right kind of funding that is needed, and let's bring this building to the 21st century.
Now that, that question on when last have you been to a NYCHA complex? A lot of people don't want to answer that question, but you did, and you did have an answer. Just a final question with regards to NYCHA. We've been hearing about the RAD program. Some complexes that have converted to this RAD program, the tenants are happy, but then you have other tenant leaders and complexes where they don't want it. What is your position on the RAD program?
As a matter of fact, we got the RAP program, and now we have the federal government coming in. You're hitting it right in the nose. And I appreciate your line of question, because you're really dealing with the issues that we're facing. The federal government now wants to bring forth what they call the Blueprint 2.0 that a lot of people don't know about. I've been working with all the council presidents, Donnie Barbara, who leads all the council president, LittleAfrica right here in the Bronx, who leads many of the council presidents here in the Bronx. They're very concerned. They feel that they are eventually going to get pushed out, that this is basically a backdoor to getting privatized and getting pushed out. So we have to pay close attention. We got to hear what the residents want. I mean, they're the current residents. And so I'm going to follow, to be honest with you, their lead as to what they see best and how to modify that plan, including the RAP program. I will tell you, in my district, every conversation I have regarding the RAP program, they were not interested. And I brought it up because it's always good to have options, and to see not only options, to see where they were at. And so I will follow what the tenants want, because they're the ones, that's their home. And many of them been there for many years, and at times generational.
Yes. No, indeed, it's they are the stakeholders, and they should have a seat at the table in deciding what is the best way forward for where they live.
Indeed.
So we're going to segue into education.
Yes.
Which is a whole, a whole other mess right now. What is your position with regards to how Mayor de Blasio and Chancellor Carranza have handled management of the school system since COVID hit, before the school year ended in June of this year, and then their reopening and the current rollout with regards to opening schools, shutting schools, kindergartners can go back, middle school students, high school students, not yet. Like, what would your strategy be with regards to that? And what is your opinion on how they've handled it so far?
So look, I used to work in a school. I was a school counselor. I'm still a certified school counselor. Uh, and I've been an avid supporter of schools. I brought more funding to public schools than any other council member right now in the Bronx. So this is something that is super dear to my heart, having worked in a school and see the struggle. As a matter of fact, the appointment that I had prior to this one, to this interview, was with all my principals in my district. It is something that is I'm ever conscious about the needs. And look, I think that schools for the large part of the year were the safest place for our children to be, even safer than home. Because kids come home, after they go home or they wake up in the morning and and many of them, they just put, and let's be honest, they don't even show the video. They just have their name. We don't even know they're there. Uh, there's something to be said, and the research is showing that elementary school students and middle school students are hurting right now like never before. They're falling behind by a full year because, and I used to teach online at the graduate level, and what the research showed, it works relatively well in high school, but it doesn't work in elementary school and middle school. The percentage of kids getting COVID was less than 0.5%, which in school versus we're talking about like 16,000 tests that were done to only 29 testing positive, which probably they caught it someplace else and not in school, because there they have the mask, they have the social distance, they have the best case scenario. So I'm very, very concerned that our kids are really falling behind. I think that we have to look as seriously as summer school to get our kids ramp up again. Internationally, our students go to school. We're at the bottom in the amount of days the kids go to school anyway. And so this will be a way to take some of the international models in the summer school to get the kids back onto par. We're going to have to put more funding to help those who are really, really struggling, especially those in District 75 too, or special education. They're going to need more strategies. They're going to need more time to help the kids to come back into place. But I'm telling you, the kids are falling behind. I think a better plan would have been to keep them there in the public schools, keep them open. They should have had this. The other thing I would have done different, they should have had more sites where close by sites that were suitable, that were closed anyway, that they could have school there and have teachers there and they have enough space. Would have cost us more, but it's going to cost us even more for the lack of education the kids are getting right now.
Yeah, indeed, it's it's a very touchy subject for a lot of people. It's weighing what is in the best interest of the students versus what's in the best interest of adults, and it's just while all of this is happening, the main stakeholders are falling through the cracks, which are the students.
Well said.
So that is, I hope that they come up with a plan, a real proper plan soon, because we cannot continue like this.
Let me just one more thing that that is missing in the equation. A lot of these kids are dealing with loss. they're dealing with the loss of relationship. My doctor is in counseling, so this is an area that is very dear to me. My license is in mental health counseling, and what we're seeing, a lot of kids that are depressed, a lot of kids who are anxious like never before. We need to, the state could help us with allowing mental health counselors now to get third-party reimbursement through Medicare and Medicare. They do it through private insurance, but some reason, political reason, is being blocked. That way, it could engage more healthcare providers, mental health care providers, to help these kids that are struggling. Early this morning, I had somebody call me because, and this is an adult, and we need to provide more mental health as well for the parents and the grandparents, because she's depressed and she's looking for counseling services. So we need to infuse funding. I know we're strapped for funding, but these are the areas that are literally essential if we're going to make it through the season.
Yes, now a lot of people are struggling. It's hard. COVID fatigue is real, and especially students. They miss their friends. They
Mm.
they miss their camaraderie. It's not the same. Um, Continuing on with education, now even for students who are able to go into the schools. Um, Mayor de Blasio and Chancellor Carranza have said that students must now be tested in the schools, and they're refusing to allow um, parents to provide medical documentation of testing from their pediatricians or even from the city's own Health and Hospitals Corporation, because parents are concerned that that their child is going to be there in school and they're going to be tested, and it could be a bit uncomfortable, and they want to be there but they cannot be there, but they won't accept it from outside, including Health and Hospitals Corporation's test results. What is your opinion on this? What is a possible solution here to
You know,
this?
I think you make a great point in the question. Uh, the fact is that, look, I've been tested 4 or 5 times, as I recall. Uh, I trust in that test. I trust in the results. H&H Health and Hospitals, right here in North Central, you could get either a 45-minute test or the one that comes 2 or 3 days later. Uh, I trust that test. It's the same. It's from the same companies, many times, that are being administered from in the schools. I think that they should accept uh, that uh, those test results. Sometimes it's just very, very difficult for families to navigate, and sometimes it's more convenient to get it someplace else. So I think that they should definitely allow it. I don't think a parent wants to send their kid in school if they were sick. I mean, I just can't conceive that they would do that. So, and that somehow they will fake the test results. And it's very easy for the schools to confirm that by calling with permission from the parents. So to verify. But I think, or they could set up a system that those H&H could disseminate that information, when they sign form to the school. The more red tape that we put, I don't understand why in government we like to put red tape and make it more difficult for parents that are really already struggling with the jobs and everything else they're trying to juggle together.
Yeah, no, that is definitely a problem, because some families who want to send their children to school, um, are not sending their children to school because of that. And it's unbelievable that they will not accept their own test from Health and
Yeah.
Hospital Corporation. But, I want to talk about, still on education, but I want to touch on now just when it comes to the youth. And as you said, children, young people are home, they're not around their peers. What more can we do to, one, support the youth? And then when we come out of this COVID-19 nightmare, what programs would you implement as borough president to support Bronx youth, whether it's internships, summer youth employment programs, STEM programs, vocational programs, but programs so that we can keep the youth engaged, and also, more importantly, keep the youth off the streets?
I love working with young people. If you go to even in my church where I'm a pastor, it's full of young adults, young people, teenagers. I love working with them. They're not the future, they're the now. People judge a neighborhood based on their young people. And so that's why a lot of my funding has gone to youth and to senior, the two populations that usually are very, very vulnerable. Look, in my district, I have funded orchestras. A lot of times we talk about, oh, how come Manhattan gets everything? Well, let's have elected officials fund that. And so, for example, at MS 390, we have an orchestra there with 40 kids. Watch this. They play violin, viola, the cello. I mean, you got to see these kids. They're amazing. What you could do if you give an opportunity. They would create a music studio for them, bought instrument through funding that I was able to allocate. Then put $2.7 million to fix that auditorium. So now it's one of the best auditoriums in Northern New York City because it had not been fixed for at least 60 years. Those are the tangible ways that we could create an environment. I think kids need an environment that is conducive, that it says to them, you are important, you matter, and to give them opportunities for them to be able to learn and make education very attractive. In many of my schools, every kid has a laptop. I was able through my council office to allocate capital funding. So every kid in many of the schools that made the request, they could have their laptops and they could be trained for the future. I have a program right now, and I'm mentioning all this because these are things that I want to expand when I get in. I have a program right now that in one of my schools where it prepares the kids to take the exam for specialized schools. You go to Bronx Science and Stuyvesant, you don't see a lot of children, black or brown children in those schools. I mean, it's a small percentage of black and brown kids. Why? Because it's not that they're not smart, of course they are, it's that they haven't been trained on the exam. So for example, one of my schools that I had this program, we had kids that end up in Bronx Science and Stuyvesant for the first time once we instituted the program. This is some of the innovative ways that we can get our children prepared. We got to give them the tools, we got to give them the experiences. And the summer youth employment, myself and my colleagues, we fought very hard. The mayor wanted to cut it all out, gut it all out, and yet we have billions of dollars are going to other things. We were able to save that program. We want to do it again this summer. My model, my vision, anybody who has heard me talk about young people will hear what I'm about to say, which is I want to keep our kids so busy doing good, they'll be too tired to do bad. And so that's the way I was raised by my mom, and she kept us busy, and we had her in basketball. She had me in football, even though I was horrible in football, skinny guy, hairy legs running around. But it was that experience, learning teamwork in those sports and track and field, not to quit. Those were the values that I was able to get that are literally having an impact in my life right now. This is what I want for young people.
No, that's wonderful because that's exactly what they need. And it's I'm so happy to hear about the music program and the orchestra. That's just that warms my heart. That's so wonderful. Um, and of course, helping the kids who want to apply to a specialized high school, preparing them for the exam, because with a lot of families who do want their children to take the exam, they don't have the resources, meaning the money to pay um, for the test prep. And
Mm,
um, that's an impediment, that's an obstacle. And it's
indeed.
great that you're providing that to the young people in your community, because I mean, every like Bronx Science, right there in your backyard. I mean, it's one of the top high schools in the country, um, and you know, Bronx youth, young students should have an opportunity to attend that school. If they get in, they should be able to go. So um,
Indeed.
that's good to know. So carrying on with the youth, just switching topics, but it's still the youth. You talk about we talking about keeping the youth off the streets. Um, we want our young people off the streets because there's been a lot of rampant gun violence. Crime is up, crime is high in our communities. Um, you as for a president, what would you do? What would be your plan to improve relationships, community police relationships, relationships with law enforcement and young people in our community, youth programs, so that the police officers, the precinct officers, they know who the young people are in that community. And I'm always upfront. I'm full disclosure. I am not a fan of the defund NYPD messaging and push, because as a mother of a Black 12-year-old boy, I
Mm,
want more police presence because I do not want my child to be a statistic.
mm,
But what I do want is I want the NYPD to know my child, to know the other young people in the community, more programs, the Police Athletic League, summer camp programs, other programs between law enforcement and the youth, law enforcement and the community. So how would you bridge that gap?
that's such an important issue. And let me just say that I had an opportunity to go to George Floyd's funeral. I was the only elected official for New York to go, and one of the only three people, I believe, for New York that had an opportunity to be right there and then. And so I, I I was invited because they understand that I understand the pain, uh, and we need a balanced approach. And nowadays, we've seen extreme, and I'm so glad that you're right there in the center. There has to be a level. You know what's missing in our culture? Honor. To be able to honor uh, every single constituent,
Mhm.
from the police to the constituent, and back the same when it comes to the police department. It has to be a mutual relationship. So we got to create bridges. I've been working on that. As a matter of fact, I work with Reverend Louis Negron, and help him start the Bronx Peacemakers. And so they could create a bridge with the kids in the street, talking with the police department. I was with him during the Christmas holiday. It was really interesting to see the police department there and crew members there, uh, and both of them helping the kids, giving out toys, to be able to work together. We only have one Bronx. This one, at the end of the day, is one big community
Mhm.
that we got to work with. And so I'm also working with houses of worship with pastors. I have lead the Bronx Pastors Network. And so what we do is I have brought in the Cure Violence Program. I have brought in different organizations to speak to them to see in ways that they could create. And I brought the chief of police as well, so they could work and they could become the bridge makers. And so now we're putting clergy in all of the precincts right here in the Bronx to work with them to help understand how, because sometimes police officers, they don't live in our neighborhoods. So, and some of them do. 60% actually of now police force is Black and brown. Something that there's a shift that took place there. And so as the next borough president, also I want to bring the tone. I want to bring a culture where we could have this level of discussion, use our office to bring people together and work with the influencers. And I have relationships with many of them that they're able to share their concerns and be able to relate those to the NYPD and also from the NYPD to the influencers too, so we could continue working with that. But I have to say, I think part of our situation here is that we don't have enough for young people. I think that, for example, you know, in my district, you go to some of the parks, you go to Washington Park, that basketball court looks horrible. And I get a lot of complaints, not in my district, but it's just a horrible situation there. And you can go to different parks. You know what I did in St. James Park? I put millions of dollars, brand new basketball court, brand new handball court, brand new tennis court, and a brand new, never created there, soccer field, because, you know, people from our countries, they love the real football, which is soccer. And so, and then not only that, but funded different programs to work with the kids in the handball. The New York Junior Tennis League that comes and get training and teach the kids to play tennis. Again, to keep the kids, give them a positive alternative. So we don't find our kids being lost in the kids and being around, you know, the negative influence.
Yeah, that's so wonderful to hear, and I have to take a drive over to those parks in the spring with my son. I didn't know that. That's good to know. Um,
Awesome.
that's wonderful. So, you know, when just continuing on with public safety, though. Um, and I get the community engagement. Um, but how else can we, how's the best way to put it, lower the volume on this anti law enforcement messaging? Because as you just said, yes, we do have some officers who may live outside of New York City, Rockland County, upstate, but a large number of NYPD look like you and me and are in our community. Um, so it's not a lot of what's been put out there is not necessarily true. So how do we educate and inform, um, you know, their community as a whole as to, you know, what the real facts are, not some of the misinformation and messaging that's out there.
You know, a lot of times there's misinformation because there's no communication. And I think that that's what's missing. And a lot of times what happens is assumption is the lowest form of knowledge, as Dr. A.R. Bernard so rightly puts it. And and because there is no communication, there's no relationships. And
Yeah.
so what we got to create are forums. We got to create scenarios where people are constantly having conversations, and to come with agreements. And we can't just talk about it. We got to be about it. And we got to be able to come to a place where there is that level of respect. There's that level of that we have to value law enforcement. I had two brothers that were police officers. And so I understand the pressures that they go through. You know, I've been to roll calls. I provided funding for some of the precincts, uh, and and police officers right now have taken more of a reactive mode. Right, they're just waiting until something happens. I think that the next mayor of the city of New York is going to have to make a big decision because if crime continues to go up, we're going to have another exodus of people living in New York City. And here's what I want to get to. We know how to do it. And you say, well, how do you know? Because we got crime down to 200 and some historic lows, you know, the lowest ever in the city of New York. And then March came and the pandemic. We could get it back to that. I think the police department here are light years ahead of what we see in the rest of the nation. There was a lot of reforms that took place, and we got to give credit to what credit is due regarding that, and continue those dialogues. I think they're so important to take place because I'm going to tell you something. When there's a shooting, people are not calling their friends; they're calling 911 to have a police officer show up, and that needs to be supported. I know I was in the middle of a shooting one time. There were kids all over the place and they were dropping on the floor. I was so mad. I just stood there. I couldn't even tell where the shooter was at. And little did I know he was behind me. And I just couldn't lock my eyes. But I called the police, called 911, and in 10 seconds, they were there. I was still on the phone when they were there. And I'll tell you, it felt good. And everybody there was grateful that that level of support was there. And so we can't put everybody in the same basket. Look, there are bad doctors. 250,000 people die of malpractice every year. There are bad teachers. There are bad pastors. And you're going to have to say in the police department, but let's don't throw everybody in the same basket. You know, let's don't assume that every police officer, I think the vast majority of them love law and order. They love their community. They care, and we need to support them.
Yes, we do. We absolutely do. So I just have two more topics that I'm going to touch on. Thank you so very much again for, this. I'm really enjoying this interview and
Me too.
your your solutions and your plans for the Bronx. I want to touch on what's been a big issue right now in the Bronx, and that is healthcare. With COVID-19, we see, a lot of Bronx residents do not have health care. So that's one. How can we improve that? And then two, Dr. Cabrera, is this issue with the largest private hospital system in the Bronx, Montefiore, and United Healthcare, because right now you have Bronxites who don't have a doctor anymore because of the fight between Montefiore and United Healthcare. So I'd like your comments on that. And as borough president, what would you do to help resolve that? And what would you have done to try to prevent this situation from happening?
Well, let's talk about the HNAs first, as you brought up. So I go in that order. The health and hospitals. Look, just a few years ago, there were people pushing to close them all down. Imagine if that would have happened if during COVID-19 we didn't have the Health and Hospital Corporation all these hospitals, including North Central. North Central right now have 2 floors of new beds, ICU beds. I was there for the inauguration, and I want to thank Christine Contreras, who's done a fabulous, fabulous job there. So we need to keep funding. I think healthcare is a right at the end of the day. I like the Biden plan where you have a public option. Many people love their healthcare provider. And so I'm going to be supporting our new president, who will be on just in a few days. And so, in regards to the public option, I think it's the best plan I've seen yet. And regarding the Montefiore, I I, I think that that is a lot of the private hospitals are struggling. As a matter of fact, Montefiore Hospital, a lot of people don't know. If they were not to have any funding coming in, they will only last about a month. That's how much savings they have. I had a conversation with the president myself. We're talking about 90% of the people that go there are, have some kind of federal insurance, state insurance, Medicare, Medicaid. Uh, Having said that, I stood with the nurses. I think that the nurses patient ratio right now is too large. I mean, have anybody who's listening to this been hospitalized? I know I was, and they're just seeing too many. Forget about. I'm not talking about during COVID. I'm talking about pre-COVID. It's just unrealistic to ask nurses to do the level of work that they need to do when you're the most vulnerable health-wise, uh, and have too many patients. It's just not realistic. So we got to fill that gap, whether it's at the state level, and mainly it's going to have to come from the state because they have that level of funding. And so we got to keep sounding that alarm to take, because healthcare is a right. It has to be done rightly. And I think that's where there is a disconnect for funding to be able to do that.
Yes, that's a surprising, a shocking figure that you just said with regards to um, the financial health of Montefiore. Um, you know, that's Montefiore is my hospital. So
Yeah.
my doctors, my pediatricians, my primary care, my everything. And I did not know that.
Yes. In fact, you'll be surprised to know St. Barnabas, uh, the state asked Montefiore to take it over. Montefiore said no. And because St. Barnabas is out of money. They might have gotten a little shot in the arm right now through COVID 19, but they're broke. I don't think people realize how New York City hospitals are struggling in a huge, very huge way. This is not Columbia Presbyterian when you have a lot of people with private getting specialized surgeries where they're bringing hundreds of thousands of dollars. We're talking about 90% of the people are there, Medicare, Medicaid. It's hard to run a hospital that way with the level of reimbursement that you get from the state. It is, we need to do better. We need to show that we really do value the health of people and the health care of people through that funding.
Yeah, we do. We definitely do. Well, so the last and final topic that I'd like to ask you about is ranked choice voting.
Yes.
So the borough president race is the Democratic primary will be a ranked choice voting election. We'll have a ranked choice voting ballot. And I also, full disclosure, you are the chair of the committee on governmental operations, and I did testify about ranked choice voting. And my question to you, Dr. Cabrera, is most New Yorkers are not familiar or aware of this new electoral ballot system that we're going to have, starting with the February 2nd special elections, the 2 special elections in the Bronx in March, and of course the primaries, which is all of the races. So, Dr. Cabrera, what are you doing to inform and educate your community and Bronxites in general with regards to ranked choice voting?
I love that question. So, an informed voter is the best voter, and uh, already started scheduling forums, online forums, because of COVID. Probably not wise to do it face to face, and probably get a bigger attendance. But they already schedule to in different communities, and we're going to do more to inform people how ranked choice works, because a lot of people are confused on how it happens. And this being a learning experience for me. Ranked choice is not going anywhere. It's going to stay here. The courts, there were a few council members that challenged it, and they lost that case. Actually, it was just thrown out that very quickly, and so it's here to stay. So since it's here to stay, let's educate our people. The the administration is putting $1 million towards education. We're asking to get a little closer to $4 million, ideally $5.7 million for education, so people can understand it. They don't have exhausted voting, and which means sometimes people think, oh, I'm just going to vote for one person and I'm not going to vote number 2 or 3 or 4. Well, what about if your first one does not win? Don't you want to have a say into the next choice? And so I want to encourage everybody to do Ranko, choose in top of priority, top 5. And can I be honest with you? It has made campaigning. Look, I've been at this now I'm the longest serving council member right now. And I've seen a lot of elections. I'll tell you, a lot of elections. This is the most positive one that I have seen so far. And because now we're talking about the issues rather than these crazy attacks that people come up with about things that don't affect everyday people's life. To talk about the things that you have brought up today, I want to commend you for this interview, because you had literally addressed in a very real way what our people are struggling with. People want to know, they want to know answers. They want to know, what are you going to do and what's the point? What's the point and what are you going to do about it? And so I'm going to continue doing that. But not only just a rankchoicenyc.org, they provide training to candidates and to the public at large. So I want to encourage everybody to go to that website so you can learn more about it. And here's the thing. The reality is, in the last 3 months before the June 22nd election, there's going to be a big ramping up. Every elected official, every candidate that is running is going to want to make sure that their people know how to vote. And the public at large want to vote. And everybody's going to be looking not only to get that first vote, but if somebody says, no, already, this is my friend, well, can you give me number 2, And what does that mean? Automatically, organically, you're going to have a lot of those level of conversation. I'm already starting to see that in an exponential way.
No, that's true. It does make people focus more on the issues. Candidates focus more on the issues.
Indeed.
I'm encouraged to hear that you have plans to educate the constituents and Bronxites in general, because that's really important. So, Dr. Cabrera, I want to say thank you again so very much for joining me this afternoon and for sharing with our viewers, what your plan is for the Bronx. Wishing you, again, a happy new year, wishing you all the best with your borough president's campaign. And it's exciting times, and this campaign and many campaigns give us something to take our minds off from, the whole COVID pandemic. So again, Dr. Cabrera, thank you so very much for joining us at Little Africa Bronx News, and we hope you come back soon and keep us up to date on what's going on with your campaign, but also what your council office is doing in the community.
Well, I want to thank you. This was a very pleasant experience. Thank you for addressing the issues that and really pointing out in the questions what are the issues that are really pertinent to our society right now, especially right here in the Boogie Down Bronx. So I thank you. This was great, and guarantee I'll be back.
Thank you. Thank you.